So this week in class, we talked about some ethical issues surrounding certain methods of data collection in the field of medical informatics, and we looked at a specific article about how Google searches can be used to identify trends in the opioid crisis, and specifically with individuals who are addicted to heroin. And I think that's a really beneficial tool, especially because a lot of the time when looking for data and looking for individuals who are addicted to opioids, it's hard to find them unless it's through the snowball method, in which you find one individual and then you have them connect you to another individual, and then at that point you're sampling the same community and the data is no longer generalizable. So I think that there's definitely pros to the Google search method. However, it is a lot harder to obtain informed consent, because that would be hard to contact individuals and ask them if their data can be used based on their Google searches.
So big data is becoming the key part of health informatics. The big data is volume, velocity, and variety, which is diverse patient data that's not been previously analyzed yet. And the use of these data to create algorithm and analyze further into the helping and finding what is best for the patients. And as in lecture, how social media data can create simple analysis, for example, the use of drugs. And I found it interesting how these geographic data do match with the which cities do have the highest use of drug, etc. And this shows that the use of data could impact the health informatics in general, um, help patient in many different ways, even could find what it caused, or what's the best option that are available for the patients.
This week's topics discuss the recent exploration into the combination of big data and its effects on medical care. With the increase in available data and growth of machine learning and artificial intelligence models, clinics and doctors are now able to create models to help better evaluate their patients. This should lead to better care and treatment options for the patients. However, as with all technologies, there are some pitfalls that must be avoided. One big risk I can think of is where the data is coming from. The models used have to be unbiased. Doctors and care providers must validate the sources, because it could potentially be easy for companies behind certain medicines or treatment plans to skew data and results in order to gain profits by recommending their treatments more and more. On the topic of machine models to predict potential drug and alcohol abuse occurrences, a risk I see in this area arises in how the data is collected. I believe the context must be taken into consideration with predicting things based on keywords. Search results could arise for drugs and alcohol due to a number of reasons, and not necessarily because the person is using drugs or alcohol. Whatever the case may be, in all medical fields that have started using big data, the standard that must pertain is the care of the individual patient. Every person's needs is different, and individualized care must be given to each person.
I think the use of data to make decisions and predictions will continue to increase as the technology continues to develop. However, in regards to using data in the medical field, I think it's important that we're careful with how much weight we put on that data. The article mentions that PA technology might either provide additional information or give the definitive answers to patients. I think relying too heavily on the PA technology would lead to putting less focus on the condition of a patient, and would instead come to conclusions based on data from large populations of patients. That direction has many potential risks for error, so I think the PA technology should be used to assist doctors rather than making the decisions for them.
This week in health informatics, we learned how we can utilize social media in order to create hypotheses, draw connections, and form conclusions based on information available to the public. But given the amount of information available to the public, the question goes into how do we determine what is useful while being as thoughtful and efficient as possible. According to David Alfandre, technology will help medical professionals predict and make decisions easier by automating how information is being processed via AI. In theory, this is good, as technology will always improve over time. However, in practice, there is a level degree at which this is true, just for the fact that AI is not perfect. Even self-learning in AI will eventually fall into algorithms that will generalize information. Since all AI is black and white. There's no really gray area between it. It's only a bunch of zeros and ones. You can't really measure the level of degree or margin at which AI will distinguish information as being useful versus what a human distinguishes as being useful. And so that is the biggest concern that I have. Because AI cannot discern the gray area between what is useful and not useful to the level of degree at which a human could, I do not believe AI should be utilized in such a way in order to judge whether or not information is useful or not.